Nice to see everybody today. I'm Dr. Karen Philbrick, and I'm the Executive Director of the Mineta Transportation Institute at San Jose State University. And I have the pleasure of being the moderator for this final session of a two-day virtual event. So we're so pleased to see that so many people are still engaged. Clearly, this topic is of critical importance. And I'd like to start by just applauding Shiloh and her team for the significant efforts that you take, excuse me, that you address every single day. And as many of you know, Silicon Valley Bicycle Coalition is the only organization working for better bicycle infrastructure and policies in both San Mateo and Santa Clara counties. At the end of our session today, they'll be sending a link so that you can consider becoming a member. Now, we only have 48 short minutes, so I want to be very mindful of our time because we have 4 outstanding experts that have joined us for today's panel, which is titled COVID-19 and its impact on the environment and transportation. We've pivoted a little bit since we first announced this description because we are seeing some congestion and recovery. And so we will have some hard data points from our colleagues from the Metropolitan Transportation Commission, and then we'll hear from our other speakers about advocacy. We'll start with each of our speakers giving an opening frame from their own unique perspective, maybe 3 or 4 minutes or so, and then we'll go right into the moderated Q&A. Please, as with your other sessions, remain on mute if you are not a speaker. Put your questions into the chat box, and please be engaged. We want this to be very, very lively. So we have Doug Gordon, who's the co-host and producer of The War on Cars, joining us from New York City. We've got Toshi Shepherd Ota, principal engineer of new mobility for the Metropolitan Transportation Commission, and I believe a father of a relatively new child as well that I got to meet during our planning call. And then we have Zabe Bent, director of design for NACTO. And finally, rounding out the panel, we have Nicola Shibo. That's Dr. Shibo, and she's the program manager for new mobility for the Metropolitan Transportation Commission. They all deserve a very lengthy introduction. They've won awards, they've authored groundbreaking literature, they've made significant changes. But let's hear from them because you can read their bio online. Let's start with the frame. Toshi, you're the first person I see in my camera, so why don't we start with you?
Great. Well, I'm excited to be here today. So I come at this as just more of a general multimodal planner and interested in how do we move more people in the Bay Area's transportation system and fewer cars. And during this COVID period, we're really seeing, you know, as the data will show, just people are steering away from carpooling and transit. And so we're really interested in how can we take advantage of more efficient roads like biking to keep people away from buying and driving SOVs. Alrighty. And I think we had some slides, but maybe we'll follow up with that.
I look to my colleagues at the Bicycle Coalition. Do you have some slides up for Toshi? You might have to wing it. Oh, there they are.
All right. Alrighty. So next slide, please. So as I was saying, or as Karen mentioned during the introduction, you know, a couple months ago, traffic was way down. Within the Bay Area, we were seeing volumes that were 50% below normal, and it was, you know, very strange time, but we've seen a really quick rebound around the region in traffic to the point where a lot of the region is now back to pre-COVID levels. And we've seen the quickest response or resurgence in traffic in the corridors leading out of the region to the periphery, and then also along the BART corridors where people are avoiding transit. But we've seen the lowest traffic levels really in San Mateo and western Santa Clara counties. Next slide, please. As I mentioned, transit is way down across the board from all of our operators. and has been much slower to recover than traffic, unfortunately. Next slide. This is the Bay Bridge, where we've seen traffic volumes fully recover, but carpool is still less than half of what it was. And the left just shows the profile. And even though traffic's still a little bit down for the day, it's actually over, beyond fully recovered during the peak hours. So people are really, unfortunately, avoiding those efficient modes of carpooling and transit. And then next slide. But as I mentioned, biking and bike share is sort of like the one bright spot where we did see pretty quick rebound in biking or in bike share, where we have data within the 5 cities where it operates. In San Jose, which is harder to tell individually here, we are back up to levels above where we were last year. And those trips are now really dominated by e-bikes, which have been introduced in the last 6 months. So we do see this as a, sort of a key opportunity as we do look at getting people out of cars or as good first last mile options to transit. And with that, I'll hand it off to Nicola.
Hi, everyone. My name is Nicola Chabot. My background is in complete streets. And I guess I provide a good complement to Toshi, since my background is in urban design as well. And so that's the lens at which I view streets and street design. And specifically my research in the past focused on livability. So I'm just really happy to be here to talk about livable streets and kind of what's happening, the trends that we're seeing at the local level. And so I'm not sure if you were able to attend, but kind of when COVID hit the Bay Area in March, MTC really started thinking about how can we help cities and counties pivot and create safe, accessible spaces for people to bike and to walk as kind of a public health imperative during this time. And we did a series of webinars. We had Vignesh present on best practices from Crossroads Lab. We had Tony Garcia from Street Plans present, and then we had Tool Design Group present best practices on safe social distancing strategies and interventions as well at that time. And so we started tracking what the cities were doing in terms of the strategies that they were implementing. It was a collaborative kind of open spreadsheet, open access to that, that we were monitoring. And we began to see cities start implementing shared streets, signal timing modifications, open curbs, where you just have cones and take a lane and create extra space for people to wait and line up, given social distancing. And we tracked these strategies between May and June. So this data reflects May to June, but it's a fluid situation, which is constantly evolving. And so we found that 16 different Bay Area agencies had implemented these 5 different types of social distancing interventions, and signal timing modification was a really important one because there wasn't a lot of guidance on that. We did see a guidance emerge from NACDO, Streets for a Pandemic Response, which provided, great street typing for COVID response. And we provided emerging typologies for signal timing modifications. So we can go to the next slide. So these strategies are emerging, but they're also normative in a sense. So it's kind of an interesting hybrid. It's not intended to be purely prescriptive, but intended to be based off of precedents that we were seeing and that we wanted to encourage as well at the same time. So shorter cycle lengths, so creating more frequent crossing opportunities for pedestrians and people who bike. We wanted to have signal phasing 24/7, so not requiring flash settings or PED actuation at night. We wanted to emphasize pedestrian recall, so the automatic walk phase and not requiring that actuation for PEDs. And then also cities were innovating at this time in terms of arterial operations, and Santa Clara County actually came forward to us with an idea for research and development with regards to contactless buttons, given the fact that nobody wants to touch big buttons right now. So can we actuate them without physically touching a button? So this was really about improving pedestrian mobility. Next slide. And we also really wanted to emphasize that safer crossings, signal timing strategies are critical during this COVID era as well. So creating enhanced signal safety margins, so giving people who walk and bike longer yellow, all red, and walk signal phases. Also leading pedestrian intervals or LPIs, or even leading bike intervals or bike scrambles, as there's some other iterations of these, so that people who walk and bike can begin crossing while cars are stopped at the red light. And then minimum green phases, so setting that green time so that the person who bikes actually has time to clear the intersection. And finally, we came forward with emphasizing slower vehicle speeds. And I think every planner that or engineer that I've talked to recently has commented on kind of the increased vehicle speeds that we have been seeing during COVID. And so this is a really important part and can connect to cities' Vision Zero campaigns. So instituting advisory speed limits like the city of Fremont did, creating that community campaign to really slow drivers down is critical. Slow speed signal coordination, so coordinating your signal timing for people who bike and transit speeds is also an effective measure that can be taken. And then removing that signal coordination so that cars have to stop more frequently, and so they're not just zooming through all green lights. So these are the key strategies that we saw emerging and that we thought were best practices during this COVID era.
Thank you so much for that presentation and for those data points, as well as for the visuals. I do know that you did document what open curb was. Perhaps you saw that question in the chat feature, but in case it was missed, could you briefly repeat that?
Actually, Zabe can probably explain it better than I can, but
no, Zabe.
So from the typologizing that we did, it's essentially when you cone out an extra lane, you take away parking lane or driving lane to create extra space for people waiting in line in front of retail or just for walking and biking as well. So it can be used for that as well.
Thank you for that. Let's turn now to Zabe Bent, please. And if you want to kick off by offering additional thoughts on that, please do, or take it away.
I think someone in the chat box actually said, is that what's in Nicola's background? And it looks like maybe it is. It looks like an extended lane there, but maybe I'm wrong. Maybe it's just a corner bulb.
It's kind of more of a curb extension.
Maybe it's just a corner, yeah, it looks like a corner bulb. But imagine that for the whole block. Yeah, imagine that for the whole block. But yeah, so my name is Zabe Bent. I'm the Director of Design at NACTO, and I think everyone knows who NACTO is, but we represent 86 transportation agencies and transit providers. And for our Streets for Pandemic Response and Recovery, which is the resource that Nicola was mentioning, we partnered also with our global team, which works with about 100 different cities over the course of about 5 years. And I'm just going to talk really quickly about some framing sort of principles and comments. And I think to the point that both of you mentioned so far, that early on, a lot of the work was focused on social distancing and trying to figure out what is the response to the pandemic and trying to figure out how, as city transportation agencies, transit providers, et cetera, could we be responsive? And a lot of that work was documented through our Transportation Resource Center and many other sources. But I think now we're seeing a lot more cities try to figure out what do we do to support recovery, and understanding that recovery might not be incredibly smooth because we're all at different places on the curve of the pandemic, and potentially, you know, depending on how outbreaks go, that's going to shift. And so flexibility is something that we're all trying to figure out how to incorporate into our projects. I would say that the things that we're seeing in different cities across the country and working with our global partners is understanding who needs to travel, where, and when, and what is the best, most efficient, most equitable, most sustainable way to get them there. And those are the things that we're all grappling with, and that I challenge everyone in our industry, quite honestly, to find the right answers to. We're not just dealing with walking and biking and, you know, dining streets or what have you. We still need to work through what safety considerations look like today. As you were talking about speeding, look at what access looks like and how to incorporate critical services into the projects that we are proposing and the projects that we're putting on the ground. So every open street doesn't just have to be open or slow street that's just sort of play space. How can we combine that with testing sites? How can we combine that with other critical services and really try to streamline the process and sort of break down some of the silos that we have become accustomed to make people's lives a little bit easier and to streamline some of the work that hopefully all the different transportation and public service agencies are doing. And so I'll just close by saying that, you know, we want to make sure that the work that all of the cities are doing, that all of us are doing, is really responsive to the most vulnerable populations, whether that's in terms of demographics. We already know that Black, Indigenous, and Latinx populations are seeing 3 to 9 times more severe impacts. But we also need to think about frontline workers. Even when we think about dining streets, a lot of people focus on the clients and the patrons. What about the workers? What are we doing to make sure that the workers are protected in situations like that? And then finally, we all know that transit is going through a serious, very dire situation financially right now. But we also have to think about what we can do as an industry to support, even when it comes down to placemaking, when it comes down to walking and biking, understanding how we can connect those various networks together to make sure that we're using our transportation options the way that most people actually see them, as part of a multimodal package, right? I don't wake up and say, I'm not going to walk to my car today. I'm not going to walk to this parking spot today. You know, we have to still walk to our car, to transit, to biking, whatever. And figuring out how those networks can be complementary to each other. And again, understanding where do people need to go, when do they need to go there, and what is the best route to get there, and where is the need greatest. And with that, I'll hand it off. Thank you.
Thank you. I've got a burning question after we hear from Doug about sanitizing and shared bikes, but we'll get to that in a little bit. Doug, take it away, please.
Hi, yeah, thanks for having me. My name's Doug Gordon. I'm the co-host of a podcast called The War on Cars. And, you know, I'm here representing them, but I'm also a street level advocate and organizer here in Brooklyn, New York, who, you know, I've advocated for safer biking, for better bike share, for pedestrian plazas, safer sidewalks, safer crossings. So, you know, I come at this issue from kind of Joe Citizen, who is calling my city council person and saying, why isn't there a safer street on our way to school, or stuff like that. As a podcast host, you know, the War on Cars focuses on cars as a thing that has fundamentally ruined a lot of our communities. Even though they are necessary for so many people, we obviously know the environmental effects, but there are also the political and cultural effects. We just did an episode on vehicles as weapons, as we're seeing this growing trend of people ramming protesters at the Black Lives Matter protests, including cops using them in some cases. We have talked about the phenomenon of driving while Black and how important cars are to certain communities to get around safely. But we've also talked about we have a good episode that I think is a good starter episode for people on the liberal opposition to bike lanes, how sometimes your most liberal and progressive communities in the country, Berkeley, Cambridge, Park Slope, where I live, tend to have the most vociferous opposition to progressive transportation and seem to be the most addicted to their cars. So I think, if people want to check out the podcast, that's a good place to start. But that's sort of my overall perspective. I'm also a writer, and I've focused on some of these issues in a lot of my writing.
Thank you for framing that for us. Before we kick off here, do we have any comments from the panelists to one another based on what you heard? Okay. And I don't see any comments yet in our chat feature that have not yet been addressed. So Doug, since you were our most recent speaker, let me just kick it off with you. During our planning call, you also mentioned that New York City congestion was almost back to pre-pandemic levels. What inequities were exposed when congestion was down?
What inequities weren't exposed when congestion was down? So for some of us, right, who had the luxury of working from home, it was blue skies and it was pleasant to walk around if you had someplace to go. But for, if you look at maps of our city in terms of where the most infection rates were, they were directly related to communities of color, people in essential jobs, not just hospitals, but grocery workers and people who had to actually be at a place of work. And those are historically the places that are underserved by transit, by good cycling infrastructure, by even just safe routes for walking. And so I think those, at least from our perspective here today, were like some of the biggest inequities, because those people still had to get to work. And it's, now, especially as things, as you said, have returned to normal, at least in terms of traffic, those people still have to get to work. And they're doing it on buses that are not coming that frequently. They're doing it on trains that are pretty unpredictable. So sometimes maybe you'll get an uncrowded train and it's easy to social distance, but at other times it's a really kind of Russian roulette. You could walk there could be a delay and then you're stuck. So I think, the biggest inequity that was exposed was sort of who needs to get around, how they get around, and for what purpose.
Mm-hmm. Yes, thank you for that. We've got a question from one of our participants here. If COVID is, pardon me, let me go back up here. Does anyone have any comments on the effects of the COVID-19 situation on supply and demand of bicycles? So this is open to any of our panelists here, either about causes, sustainability, implications. Anybody can shed light on that topic.
Okay, I thought Doug was going to jump in.
Well, someone who hasn't spoken should go.
Go ahead, Toshi. You can go first.
We have been talking to a lot of retailers, and clearly demand has ticked up. There's not as great data on it, but we are hearing anecdotally that demand is up quite a bit. They're also a little bit understaffed and doing shorter hours. And there's also just a lag for when they order these bicycles until they can actually get them in their shop. So there's now that demand is shown, it's taking roughly 12 weeks or so to them to build back up supplies. But we are, I guess initially it was seeing the greatest demand, or they're least able to meet demand at sort of the $500 to $1,000 price points. But I think there's been demand sort of at all levels of bikes.
Yeah, I would just add to that we've also seen a change in the way that people are sort of selling and delivering bikes. Like we had a few that had sort of mobile bike deliveries in some areas. There's also been demand for bike clinics and workshops, and figuring out how you deliver a clinic or a workshop in a socially distant or masked manner has been interesting to watch different suppliers do. But people wanting to understand how do I get a bike that's affordable? Is it okay to buy a used bike? How do I measure myself? That sort of thing. And then how do I learn about maintaining a bike? In some cases, some people might not have been on a bike in decades, in some cases just a few years, and trying to understand that. And so watching people navigate that, those questions has been really interesting and in some ways encouraging. And I think we all want to see more of it and hope that people will hang on to them over time. But I think a lot of that comes down to how does the infrastructure support people through different conditions and through different neighborhoods, as Doug was saying, making sure that it really does reach everyone. Yeah.
Okay, great. Thank you. We've got some chatter happening now. I'm going to go to the next question from our participants here, and I am reading them verbatim, so please forgive me as I look here. If COVID is moving everyone to single passenger cars, plus the congestion maps imply that people are commuting less than 10 miles, how do we move these people between home and work? They clearly aren't returning to transit. Yes, transit ridership is down upwards of 90% across the nation. So that's a very good question. Who would like to address that first? Dr. Nicola, would you like to have a comment?
I think this is a very difficult question. I don't know if if I have an answer. I think that everyone right now is trying to find an answer. So I work on several TDM programs in terms of trying to get folks to shift modes and incentivize them to shift modes. And the timing right now is difficult. It's not exactly palatable to take transit with certain users, and so I think we're going to have to think very carefully about the incentive strategies that we do apply, when we're ready to have a full-on campaign again, getting people back onto transit or other shared use modes. So I think it's a very difficult period that we're still dealing with, and I don't think I have a solution for
I can jump in a little bit on this. So right now we're seeing transit, on a lot of the regional services, so like BART and Caltrain, they're down to about 10% of normal. So we can actually accommodate that full 6 foot social distancing up till about 75% of capacity. So there is room on transit now where people still can safely maintain social distancing. So I think a lot of it right now is marketing to help people realize that we are gonna, if we do maintain this 6 foot social distancing, we are gonna reach a point where we aren't gonna be able to accommodate that though. So I think that's, begs another question, which we haven't reached yet, but will be coming soon, of how do we allow people, safely allow people onto transit, but with reduced social distancing, but we're not quite there yet.
Sure. Zabe, did you want to comment?
Sure. I wasn't sure if Doug was also going to, but I'll jump in. I have to admit that this is a really difficult question for me to answer, because transit is being used today now. There are people who are already still on transit, and the notion of sort of getting people back to transit to me is a conversation that sort of fails to recognize that the people that we're trying to get back on transit are people who have options, people who should think about how their options align with their goals and their values. And I think instead of saying, how do we get people back on transit, I think one of the questions and one of the points we should be talking about is reminding people that transit is still operating, that transit is still, our healthcare heroes are on transit, overwhelming numbers. And if people don't feel safe, then that's on us to sort of educate people, because we know, Tokyo, Taipei, Paris, Milan, there's so many cities where transit is still operating. In some cases, never stopped operating at, the sort of normal levels. And it's really about figuring out what will it take to remind people that transit has always been there for them, to remind people that transit is a solution that aligns with their goals and values. And if it doesn't sort of meet the goal, then what if we actually invested in the types of projects, of interventions, whatever it is, that would make transit feel comfortable for people? Like, instead of saying, transit's not working, I'm going to abandon it, what if we actually made it work? I think that this is the dichotomy that is really difficult for us to work with, because on the one hand, sure, if you don't need to be on transit, especially now when, it's not operating at the same levels of frequency, then you shouldn't be on transit. And quite honestly, if you live in the core and you're going somewhere in the core, you probably never should have been on transit. You should have been walking and biking. We don't need people to continue to crowd onto transit. But for people who need to make longer haul trips, or for people who don't feel like walking or biking is an option for them, we need to make sure that transit is still there for them tomorrow, not just today in the last 5 months, because it has always been there.
It almost speaks to sort of like a World War II level mobilization that we need in terms of messaging. Like we've probably all seen those posters of like, when you ride alone, you ride with Hitler, right? And I think like we need the same messaging for transit, just like you're saying, for our heroes. Like if you don't need to be on transit and you have a choice and you can bike, because that spot that you're saving on transit could go to an essential worker. If you have a choice other than driving, please do it, because we can't have our roads just jammed up so that the people who actually need to get somewhere and don't have another choice, so they can get somewhere, so ambulances can get through, so essential services can get through. So a lot of that, in lieu of immediate infrastructure investment, needs to come from messaging from our mayors, from city council people who are out there doing photo ops where they're on transit, wearing a mask and showing that it's perfectly safe. I mean, I've taken the subway now a couple of times and it's fine. It's totally fine. I felt much safer there than I would on the 2-hour drive I need to take that next week to go see my family. So we just need like a really strong, huge marketing push where we're going to tell people like, we're all in this together and let's do this.
So you'll be pleased to know that that APTA, the American Public Transportation Association, the current chair is Nuria Fernandez, who many of you know. She's the CEO of the Valley Transportation Authority, and she established a 28-person restoration and recovery task force. And one of the subgroups is focused on messaging and how to get the message across that transit is safe. But we've got a lot of chatter that's happening with some really interesting points of views. So I'm going to pose some more questions from our participants. In the interim, I do invite the 110 people that are engaged to look at some of the resources that have been provided by other participants in the chat box, assuming it doesn't distract your attention from our speaker's message. Next question, we probably won't get to them all, but this is a goodie. Post-COVID, transit should be free and micromobility should be part of our public transit system. What's your advice for how we make it so? That's a free for all. I think all of you probably have a terrific response. Who's first out of the gate with that one? Why don't I select one of you, since we have many questions?
Well, I can comment at least on not on the fare part, but just on the integration with micromobility. It's certainly something that we are looking into now that we have bike share in 5 cities in the Bay Area and another dozen or so who are looking to implement it in the next year. And so we are looking at what are the opportunities for micromobility, bike share to, replace or provide an option to people who live on corridors where transit service is either being reduced or cut. As just sort of a viable backup, and also looking at how can it be a better first last mile option to longer distance transit services to help make transit more attractive. But there's obviously it's an important complement to transit, and so we are looking into what role micromobility can really play in the broader multimodal system.
I can jump in. I think if I understand the question correctly, I think one of the other things to think about is as we are investing in walking and biking and micromobility and taking space for some of those open curbs, the extended sidewalks, bike lanes, whatever it is, we should leave space for transit. There's a lot of times when I see projects and I think, okay, well, this is great. Is this temporary? What's your long-term strategy? How are you building on this over time as we move into different phases of recovery? And where does transit fit into this? Because one aspect of this is the messaging around how do we, make sure that people understand transit is safe, or how do we make sure that transit is safe, the investment in those, but also the operations, making sure that transit is fast and reliable and actually performs on time is about the street space and the signal timing and all of these different components, and making sure that as we make those investments today, we are thinking about what happens. And I think someone in there was saying that in the Bay Area, July 2021 is the date. That gives us a good lead time to figure out what we need to do to get transit truly efficient and accessible and really like meeting people's needs by the time that office workers need to come back. Because I think a lot of the focus right now is on how do we get office workers back, but office workers don't need to be on the roads today now. So what is the long-term strategy, and how can shared micromobility and biking and walking, again, complement that sort of transit performance and transit accessibility?
A quick question, just somewhat related to our shared mobility. Can somebody speak to disinfecting and sanitizing shared bicycles, for example? Like, as we talk about getting riders comfortable, choice riders, to go back on transit and to feel like it's safe, how is that same messaging going to carry across to get people on shared bikes, for example?
I mean, I know City Bike is doing a lot here in New York. They're run by Lyft, to sanitize, disinfect. But to be quite honest, I see people going up to the bike share stations in my neighborhood, grabbing a bike and just getting on and go. And I don't know,
in their hands.
I don't know if they know that the station has been sanitized or not, or if they've washed their hands. I think some of the fears about surface transmission might be a little overblown. Obviously, like enclosed spaces where the air is not circulating very frequently, that is a real source of transmission. But I think someone in the chat mentioned like hygiene theater, that like we need to be careful that we're not wasting a lot of money that could otherwise be used on other stuff that might actually make people safe. So, there probably is an issue. Some of that's just going to come down to maybe personal responsibility of like carry a thing of wipes with you, as a lot of us are doing these days. And before you get on the bike, like, wipe it down and get on your way. But it might be too much to ask like the publicly run transit services to like continue investing millions of dollars into UV lights and sanitizing sprays when that doesn't seem to be a major source of transmission.
So I will say a slight counterpoint to that is that I don't know that we know enough. I am not an epidemiologist. I have many friends who are epidemiologists. They don't still have an answer. And so I think one of the things to say is maybe it's not about having the public agencies take on all of that, or the bike share operators take on all of that. We have seen in other locations where they've simply had a kiosk or stand where you can take a mask and put it on. You can take sanitation equipment or whatever, whether it's a wipe or a spray, and do it yourself. What does seem to be the sort of prevailing wisdom is it's not just touching the thing, but it's touching the thing and then touching a mucous membrane or some sort of like part of your face or what have you. And that's a really different paradigm, but sort of figuring out what do we need to make available to the public and to users versus what needs to be done on a continual basis is something that I think we're going to have to figure out. But there are ways around that, and we've seen that in many cases. Again, like just having the service available at the bike share station or the pod is really different than actually continuously sending someone out. I would just like to see bike shares available in every neighborhood, right? Like that is a place to start for me. And it's really not in too many areas. They're certainly making them more available to essential workers at the start, but making sure that it's available to everyone who's a frontline worker in every neighborhood, that would be amazing.
That would be amazing. And that actually, there's a question in the chat, somewhat out of order here, that says, how do the bike coalitions get new bike owners to join and build political support to build the safe infrastructure? So bringing us back down to the bike, how do we build the support so that we have the will to build safe bike, infrastructure to get more people out of single occupancy vehicles into active modes of transportation. Doug, it reminds me of a comment you made during our planning session. You talked about fact versus emotion,
Yeah.
and how a lot of decisions are emotionally driven. Can you weave a response from those two pieces?
Yeah, I mean, so one of the things that we talked about, right, is that if you're a bike advocate, you know that you can cite facts and figures about the dangers of cars and the relative safety of bikes until you're blue in the face. But it's not going to convince someone to give up their SUV because they're, you know, they feel safer. Cars are not marketed for practicality; they're marketed for emotions. And I think a lot is going to be similar, right, with our response to COVID. We were talking about the New York Times piece about the study that there were no clusters of outbreaks on transit in places like Seoul or Hong Kong or Tokyo, places that have mostly returned to normal transit levels. But that's not going to necessarily convince like my aunt from Westchester to hop on Metro North and come down into the city to see us. And that's a feeling that I think bike advocates know very well. As far as how bike advocacy organizations can sort of leverage the bike sales that are happening and the massive numbers of people who are looking to buy bikes, you know, transportation alternatives here in New York, when you join, you get a discount at Bicycle Habitat. What if you did it the other way? You know, you buy a bike at Bicycle Habitat and you get a free membership to your local advocacy organization. Because the question is, does the advocacy organization need your $30 membership, or do they need you on their mailing list so that when they have a campaign in neighborhoods where they don't have a lot of people doing outreach, now they have a lot of people doing outreach? So I think if you are a bicycle advocacy organization, you know, you should be talking to every bike shop in your town, in your city, in your district, and asking them, you know, hey, do you mind that if we just like give a membership to everybody who buys a bike or an accessory or whatever it is? I think that would be a really great way to do it. And because then when that person has that first bad experience on the bike, which we've all had of like getting cut off, they don't think, who do I call or what do I do? They know what to do at that point.
Anybody would like to add to that?
I'll throw in infrastructure. The more infrastructure you build, the more people will take advantage of it. I think this is one of those cases where we always say, if you build it, they will come, as it relates to traffic and it relates to so many other things. It is true of bike lanes and transit and so many others. We build more infrastructure, people will feel safer using it.
Indeed.
I'll jump in there and just echo that. Based on our experience, you know, it's often the advocates and the bike coalitions that have, you know, the intimate knowledge of the roadways and where there are potential quick build projects, where there are potential complete streets projects that can be implemented during this time. And so, you know, we're really looking to you to come to us and say, hey, these are great projects. Do you want to partner with us? And so we're looking for willing partners. So lean on your partners as well to get the bike infrastructure implemented.
Very good. Excuse me, my dog has come into the room and is snoring so loud. I'm going to throw something. She's only 11 pounds, but Mabel, come on. Sorry about that. Okay, we have 4 more minutes here, and we've got one question from participant Ron Wolf. And I'd like to see if one of you could address it. It's, I'm concerned about the negative feelings when traffic comes back and people feel delayed by the new timing. So think back to Nicola's presentation and the protocols, not sympathetic, but concerned that there will be a backlash that might result in substantial and continued resistance to our work. Comments, concerns?
Right. Well, first of all, I think we need to put this in context, right? So these strategies aren't being implemented across the board. They're being strategically implemented in certain cities, in certain counties. So I don't think we're going to have, you know, a huge outcry in that unified way. It might be more targeted and come out in that sense. But I think, you know, it's a lot of it is about like looking back to the 6 E's when we talk about complete streets and doing the education and encouragement. That's part of it. And that's part of why we created those graphics, is to kind of help people understand why we're doing this. And a large part of that is being able to communicate what is happening to the public and to the stakeholders. And there's that, information gap that often happens, especially with signal timing, because it's a little more technical and less geometric to try and explain compared to a street typology. So graphically displaying that and aesthetically displaying that so it's imageable really helps people understand what we're trying to accomplish and why it's in the interest of the public good. So
Thank you for that question. What are the most effective rebate and incentive programs for promoting bike commuting? And how do we ensure that they're equitable?
Like, didn't Paris?
I can jump in on.
Yeah, go ahead.
I mean, there's a lot of great examples from Europe. It's something we've been exploring here in the Bay Area because e-bikes in particular are a great option for people commuting, more than a couple miles, but they're also very expensive. So, we're really looking at how can we get them in the hands of all people. And so I just want to, give a shout out to Peninsula Clean Energy in San Mateo County, which is actually moving forward with an e-bike rebate program for people with incomes below 400% of the federal poverty level. And so I believe that's coming out this fall. And so we're looking at other ways we can really help get bikes and particularly e-bikes because they are so expensive into people's hands. And so bike share is great in denser urban areas, but we know that we need to get, we'd like to get bikes to access, to people around the region. And so we're really excited at sort of building off of the pilots, rebate and incentive pilots that we've been seeing in the last few months.
Thank you for that. And Doug, it sounded like you had something you'd like to
I was gonna say, I think Paris offered a €50 rebate for bicycle maintenance at local bike shops. It was a great way to stimulate the economy and deal with people who might have had a bike, rusting in the basement somewhere. Lyft offered free city bike membership to essential workers in the early stages of the pandemic. So things like that. I think here in New York, there are plenty of city agencies that work with all different types of populations, from people in public housing to people with library cards, and they could probably figure out a way to make it so that if you just show up somewhere, you get however much money off. They could send mobile clinics out where they're tuning up people's bikes. There's lots of ways to make that stuff happen.
Mm-hmm. All very good points. And I want to thank you all. It's 2:49, headed right into that 2:50 time where I think Shyla is going to be taking back over. I do once again invite you all to look at the chat. There were some excellent resources that were shared among our participants. And of course, Toshi, Nicola, Doug, and Zabe, thank you. Thank you for spending time preparing for the planning call and truly for your expert comments. It's been a privilege.
Thanks.
thank you.